All right, so welcome to Unleash Your Brain. My name is Dr. Chris Slininger with the Pierce Clinic of Chiropractic, and this is a three-part series. It will be recorded, and it's really designed to be a three-part series of short little lessons as continuing education for both personal trainers and physical therapists, and basically anybody who's in the training or fitness realm to understand a little bit more about how the nervous system affects physical function and physical ability. And so today we're going to be diving into the strength portion. And so we're going to be moving pretty quick. Each one should be only about 20 or 30 minutes. And then if there's any questions at the end, we'll take a Q&A time. Or if you are watching the recorded version, you can also email me at drchris@drchrisslininger.com. So let's dive into just the strength portion. So if you're here and you're an athlete for yourself, so you're a trainer, but you take care of yourself, you probably put yourself through a lot of pressure to perform at a higher level. So it could be weightlifting, strength training of some sort. It could also be something like distance running or speed running, as well as any other type of sports or athletic training. And so you've pushed your body and you've experienced the difference between going through an intense training season versus just maintenance. And so in this portion about strength, we're actually talking about the body's ability to grow and develop, specifically by the influence that the nervous system has over strength and strength development. If you're a trainer, you've pushed other people. So you've encountered a lot of different challenges and obstacles to get people from the place they're starting to the goals that they have set or you have set for them. And so you've had to just push through, whether it be fear or just aversion to certain exercises, as well as, just mental blocks, thinking you can't do it. And then also your physical abilities. You're working around injuries, you're working through discomfort. And so you've encountered this challenge of trying to get past these plateaus that your clients are actually experiencing. If you're a person or a physical therapist, then a lot of times you are rehabbing an injured person and you're trying to create good function in a joint or structure that's been injured before, or maybe they've just never used it correctly, and you're basically training them for the first time how to use their body correctly. And so whatever it may be, it's really important to understand that all three of these will apply, because when it comes to anatomy and physiology is principle based. In other words, a physical therapist, a sports athlete, and a personal trainer could all say, well, here's the problem. We want to grow more strength in a deadlift, but they might take three different method approaches to how to increase a deadlift. But the principles that govern how the body works, how it grows, and how it develops, that stays the same regardless of the method or approach. And so what I'm going to do is dive into the principles of anatomy and physiology that goes behind the strength development, but specifically how the nervous system affects it. Just a little bit of a background for me. I was actually I was an athlete growing up, but I did a lot of individual sports. So I did a lot more things like surfing, snowboarding, skateboarding, extreme sports, things like that. Surfing was the main one I did. I joined the military at 18, so I've done a lot of physical activity through the military and all their training, and I actually became not only a physical fitness trainer there, but also a combatives trainer, so not only how to use your body, but how to use your body to fight another person's whole body. And then I also went through undergrad with a concentration in exercise science and athletic training. So I worked with 7 sports teams while I did that, and did a lot of rehab with people. I became a personal trainer. I trained myself. And then I went to chiropractic school, where I learned how to really work with the spine in the body, but I had a big focus on performance. And then I specialize now in my career in something called upper cervical chiropractic care, which I'll explain at the end. But what I wanted to give you that background so you understand. These aren't just concepts. These are things that I personally do, and I push myself to do better and better as much as I possibly can. So I've done things like I've run marathons. I've done a lot of strength training. I've done a lot of calisthenic training. I basically varied my training routines quite widely to experience what the body is capable of. And I'll tell you, it's very amazing. But these core principles are really what drives it. So strength. I want to dive into strength. In this particular one, I want to talk about hitting a plateau. And I talked about a couple things that we do, that we experience with our clients, especially when they hit a plateau, is, you can have that mental block, a fear block, an aversion to a specific movement or exercise. And you can also have just the physical limits of either injuries or pain or discomfort that you're trying to work around, work through, and do it without injuring your client. But there is this plateau that you may experience that's none of those things. It's not injury. It's not necessarily aversion, although they might be aversive to a certain exercise because of pain. But it's actually hitting this wall of physiologic ability. But you as the trainer or you as the physical therapist might actually know that they have more capability, and you're just not exactly sure why you can't get them to that next step. And so this is where they're unable to perform certain movements without a prior injury to the area. So you ask them, hey, have you ever injured your shoulder? You notice there's certain things they can't ever add that extra 2.5 pounds or 5 pounds or 15 pounds if it's a larger person. And yet there's no known injury to the area, but you're just hitting that wall. Again, like they have the ability to develop more strength, and you can't seem to push them into that next level of strength. But there, again, you can't figure out why. It's just this weird invisible wall, this plateau of no more progress. Same thing with using equal strength from left to right. Sometimes we see that they have a lot more ability to grow on one side, but they continuously lag behind on the other. So maybe the left is lagging far behind the right consistently. And then we already talked about developing muscle mass beyond a certain point. Those plateaus are usually going to be something not related to the joints around it or the muscle itself, and not even necessarily nutritional. What we're looking at when we hit these, and especially when we hit a number of these in a row, like they are imbalanced left to right, and there's no prior injury to an area, and you can't seem to develop anything further, even though there's nothing you can see that would really inhibit them. Usually we're talking about a nervous system problem. And so the principle I want to talk about is actually called neuroplasticity. Now, just to review real quick, a little anatomy and physiology, a lot of times in physical, personal training and physical therapist training, you are going to learn a lot about the neuromuscular junction. Physical therapists will learn a little bit more about the nervous system, but this chart right here should be very familiar to anyone who's watching, who's in these fields. Now, a lot of the time is spent on focusing on the muscle here. Focusing on the muscle, how it fires, how it contracts and expands, which muscles are where, which ones are agonists, antagonists, stabilizers. And then we talk about this neuromuscular junction where the nerve tells the muscle to fire. And so where these nerves attach to the muscle is called the neuromuscular junction. That is typically how far back we go, especially in personal training curriculum. And so these are called motor neurons. And so these neurons are nerve cells. And the chart, this is the funny part about this chart. The chart is always showing this little neuron as if it's sitting right next to the muscle. But typically these neurons are many feet long in the body. And some of them start all the way up in the brain. And so when we're looking at this motor neuron, just understand that you may have a muscle way down here, but the nerves can start way up here. And those nerves have to run all the way down the spine and come out the spine and come down to the muscle. And so the signal that starts a muscle contraction starts way up in the brain and has to travel down and go to the muscle. Now, you may remember, you may or may not remember this guy, Christopher Reeve. He used to play the old Superman in the old Superman movies. Now, this guy actually broke his neck and severed his spinal cord, and it shut off all the muscles in his body, and he became a quadriplegic. And what it exampled, like it's a tragedy, but it set a good example for what we're trying to cover today, which is if you lose signal between the brain and the body, it doesn't matter how much muscle you have. And the guy was a big guy, but his muscles completely atrophied because there was no signal getting out through the upper neck. And so all the nerve signals coming down here were totally dead. And so were the muscles as a result of it. And they atrophied and withered. And eventually he couldn't support himself. He lived quite long considering his injury, but it was a very, very hard life. So what I want to talk about is this idea, neuroplastic changes. So neuroplasticity, I'll define it and then I'll really explain it using an analogy. Neuroplasticity is the ability for a nerve to develop over time. Now, obviously, when you're growing up, you have nerve development, bone development, brain development, muscle development, and it's part of, childhood growing up. It accelerates during puberty, especially the bone and muscle and ligament strength. But neuroplasticity never changes over time in the same way that muscles can continue to grow every day that you're alive if you use them. So when we see a neuroplastic change, it means that the nerves either increase or decrease in their number of synaptic connections. And so just so you know what I'm talking about there is when a nerve talks to another nerve, it has these little fingers that come off of it. And if a nerve connection between one nerve and another nerve is very strong, it usually has many more connections between the one nerve and the other nerve. So the more connections, the stronger the signal. It will also either increase or decrease the strength of the synaptic cleft signaling. And so what I mean by that is you have these chemicals that get released out of the nerve that go to the muscle. Or if it's another nerve talking to this one, when that nerve touches this one, you'll have a very strong chemical release between one nerve to the other nerve, stimulating the firing of that next nerve so the signal continues down. So the chemical release gets stronger and more potent. What we'll also see is there will be a thickening of the nerves or a shrinking of the nerves, depending on if it's the signal's getting stronger and the nerve is being used more or less. So that's what we're talking about there is this axon of the nerve. That's the really long part that's many feet long in the body. So when we have nerves going down the arm, down the leg, I'm talking about the axon of the nerve will actually get thicker. And when the axon of the nerve gets thicker, it increases the speed of the signal. So the power and speed of the signal increase with the thickness of the nerve. And that same principle is true with wires in electric work, that the thicker the gauge wire, the better, clearer, and faster the signals can come through. And so when you have thicker nerves, you have better, stronger, and faster nerve signals traveling through that nerve as well. And so the more that you use a specific nerve pathway, unlike wiring, like physical electric wiring, the nerves thicken and shrink on their own. So if you use that nerve pathway over and over and over again, the nerve gets thicker in the same way that when you use a muscle over and over and over again, the muscle also gets thicker and stronger and better and is better suited for use. And so when you're training a client and you're trying to increase strength, you do need to put strain on the muscle itself. But there's another side to it, which is when you increase either the resistance put on a muscle or the number of repetitions that that muscle is being used, then you're going to naturally stimulate the nerve signal from the brain down to the body and stimulate the constant use of that signal, and the nerve will get thicker and support more use of that nerve pathway. So when you get strong, the whole point of what I'm saying is this: when you get strong, you're not just developing bone and muscle and ligament and joint strength, you're actually developing nerve strength and health as well, all the way from the brain down to the parts that you're training. So we even though we can't see it, we very much depend on neuroplasticity to support more and more strength in our clients and even ourselves. So what I want to talk to you about, the main thing is this. If there's any interference in the signals between the brain and the body along the nerve pathway, which our brain turns into our brainstem down here, then it turns into our spinal column, then we have nerves coming out of our spine, and that goes to the different muscles throughout our body. If there's any interference in those nerve signals in any place, then it will cause a weakening of the signal. And so this is literally how basic it is if you have 100% signal coming from the brain down through the body without any interference, then you have the potential for a 100% strength contraction of that muscle. If you have a 90% signal from the brain to the body, then you can only at a maximum have 90% of the strength of that muscle being used. If it's 55, the most you can have in your muscle is 55% contraction. Think of it like a dimmer switch on a light, right? If you could put like 100%, 90, 80, 70, 60, 50, all the way down on a dimmer switch, and you put that dimmer switch at 70%, for example, that means you're only allowing 70% of the electricity through the dimmer, and the light bulb at the far end of that dimmer switch can literally only shine at 70% of its designed potential. No matter how much you want that light to shine, the only way to get that light to fully shine is to get full signal through. And the same exact thing is true for the muscles and the connections between the brain and those muscles. And so what we find is this. I'm an upper cervical chiropractor, but I'm a chiropractor and a trainer. One of the main areas out of everything I've looked at and everything I've studied, the main area that gets interfered with and the main point of interference of these nerves is usually in this upper cervical spine right here. And it cuts off or it diminishes like a dimmer switch. It decreases the strength of the signal going between the brain and the body. And so that nerve, if this is a problem that's longstanding and does not get corrected or evaluated correctly and then corrected, then this will actually lead to a longstanding decrease in nerve signals between the brain and the body, which will lead to muscle weakness and a negative neuroplastic change, which means that the nerves will get weaker over time and they'll never be able to thicken as much as they could because you're not getting 100% strength through. So this is what we do here at the clinic. I want to show you really quick what we do. I can always do some follow-up questions on this one, and then I want to give you a practical application on how to figure it out. So whenever we have somebody come into our office, we go through an exam where we check things like balance through the body, how the balance is associated with the nervous system, and we're evaluating to see if and where there is interference in these nerve signals going to the body. So we do muscle tests, posture tests, movement tests, and a couple others that help us see what's really going on inside there. And we're trying to hone in on where this nerve interference is coming from. If it's coming from the upper neck, we take a set of very specific x-rays and we analyze those x-rays down to about 1/100 of a degree, and we can see exactly where the bones of the spine, and especially this unique area called the craniocervical junction, we can see where these bones are positioned and if it's causing any nerve interference. And if we find it is through the x-rays and the exam, then we can actually move forward and correct that alignment, which restores the signals between the brain and the body through this brainstem. And the way we do that is we use a percussive sound wave instrument, which is it's a very high-tech approach to correcting the alignment of the upper cervical spine. We measure the position of the patient on the table. The instrument is set to a very specific angle that's unique to each client based on their x-rays. And it's a percussive sound wave. So it's actually off the skin, and we only use a percussive wave to adjust the bones under the skin. And so it's a very gentle and very precise approach to correcting the upper cervical spine. But before you go, what I want to do is just cover one main thing and a way that you can apply testing whether or not a strength deficiency is coming from the upper neck versus the muscle itself. And so Dr. Pierce actually developed this over time. So we just affectionately call it the Pierce maneuver. But what it is a muscle test changing the position of the neck to see if the neck is affecting the strength of the muscle. So we have a patient lie on their back, and we're going to test this with each arm, okay? And what you have the client do, you have them lay on like a bench or something in the gym, and you have them stick one arm straight up in the air, and you push their arm down towards their hip. So, So you take their arm and you push it down towards their hip down here. And so you're pushing down and you're seeing how much resistance they have. Then you have them turn their head one direction. In this case, it would be the left. And you push again and you note the difference in strength. Sometimes there is, sometimes there isn't. And then you have them turn their head the opposite way and you push down and note the difference in strength. And then you do the same on the other side. And if you notice that there is especially a decrease in strength when they turn one way or the other, when you push their arm downward, what that lets us know, and this is what we know, but it's also what you would know about the client, is that they have a muscle weakness that's coming from interference in the neck, because that's the only thing we're changing, but it's affecting the strength of the arm. And if it's affecting the strength of this shoulder here, the posture center of the whole the posture center that controls the muscles of the spine also sits in the upper neck. So we'll often find spinal imbalances throughout the spine as well. That we do in the clinic, but this is a really good like field test or in gym or, client test that you can do on your own. So I just wanted to share that little practical tip that you can do. And I would highly recommend that you do it, especially with clients that you are noticing are hitting a plateau where you're not getting further in your training with them. So that's really all I wanted to cover today. And what we're going to do is tomorrow, we're going to also dive in a little bit deeper to this anatomy and physiology in the nervous system. We're going to be talking about coordination and how coordination is directly affected by the nervous system. Some of this information will overlap, but I think by the end of these 3 little sessions, you're going to have a really good collaborative understanding of how your brain and your nervous system control the ability for a person to develop physically through their strength. So I'd like to open it up for Q&A. If any of you have a Q&A, any questions, we'll spend a few minutes in that. I'll send the recordings out to everybody that wasn't here. I'm not going to send the recording of the Q&A, but you can always email me and I'll send out my email with the recording as well. So for all those who are here, thank you very much, and I'll see you tomorrow.